Hello everyone, my name is Amy Burkett and I'd like to welcome you to Sounding Board, the weekly program produced by Seroptimus International of Novato. The main mission of Seroptimus is to improve the quality of life of women and girls both locally and internationally. So today I'd like to welcome back Dr. Shiroko Sokitch. Dr. Shiroko is a doctor who cares about you. Her mission is to help you achieve the health, vitality, and happiness you deserve. She does this by using a unique blend of Chinese and Western medicine to help you learn to listen more to your body and find out what works for you. Now, in addition to practicing integrative medicine for over 20 years, Dr. Shiroko has hosted public access TV show Perspectives on Healing, still being aired in 3 cities, has a Sonoma County news column, worked as an ER doctor for 10 years, and is writing her second book. The owner of Heart to Heart Medical Center in Santa Rosa, California since 1993, Dr. Shiroko is an expert at using many modalities to bring the body to balance and wholeness. So she specializes in acupuncture, chronic illness, pain treatment, hormone balancing, bioidentical hormones, digestive problems, and brain chemistry balancing. So thank you, Dr. Shiroko, for joining us today. And I know that we are going to be in a series of conversations about how to live a vibrant life. Mm-hmm. And you've mentioned that there are 9 key factors to staying healthy as we age, and they are the hormones, immune system, brain health, circulation, digestion, bone and joint support, appearance, attitude, and stress management. And for today, we're going to talk about brain health. Mm-hmm. So you mentioned, the list of 9 key factors. And why is the brain so important?
Well, the brain is the computer that runs the whole show. So basically, without the brain, nothing else would work. Okay. And each part is very, very important. Without your heart, nothing else would work. Without your digestion, you wouldn't be able to digest food. So every part of our bodies is vitally important, but our brain is the computer. And without it gives the instruction to the rest of the body. So without that, there wouldn't be any instruction. It would be a haywire system.
Haywire, okay. Yeah, so what are an overview of the functions that the brain regulates?
Well, it regulates everything. So different parts of our brain, there are over 100 billion nerve cells, and there's over 100 trillions of interactions that come from the brain. Every single thing that ever happens in our lives is recorded in the brain. It's like HAL, the big computer from that movie 2001, where the brain regulates everything. It regulates how we breathe. It regulates our digestion. It regulates our hormones. It regulates our thinking, our mood, our movement, our feeling, our physical sensation. So everything.
Wow. And thank goodness for the skull for protecting that brain.
Exactly, yes.
Yeah. So describe the brain in relation to Chinese medicine.
Okay, so I'm going to backtrack just a little bit because in Western medicine, we don't understand the brain as well as we could. And I think that's one of the interesting things is that we haven't really understood everything that we can know about the brain, and we probably still don't. There's so much information, and yet it's increasing every single day. And so from the Western perspective, we know a few things, and we know how to do some things, but we don't know everything that the brain does. in Chinese medicine, the brain is, so all the organs work differently than they do in Western medicine. And the brain is a part of what's considered the kidney meridian. So there are 12 main organs, and the kidneys regulate the low back, the knees, the bones, your overall sense of having energy, big transitions in life, and the physical matter of your brain, and the emotion of fear, and your hearing. And every organ in Chinese medicine has many different functions beyond what we understand them to have in Western medicine. And so the physical matter of the brain is really regulated by the kidneys. And also, if you translate into Western medicine what else the kidneys do that regulate overall sense of having energy and big transitions in life, the kidneys also regulate all your hormones. So when in Chinese medicine, as we age, the kidneys decline in energy, and that's one of the things that initiates aging, is as the kidney energy begins to decline. And they say, or we say, that it starts at about age 35, that energy begins to decline. That's also when some women begin to experience perimenopause. Men also begin to experience symptoms like it's harder to lose weight. Sometimes they're more easily tired. They have more trouble with exercise. So it seems consistent with what I've observed with people over the years. And as our science sort of catches up with some of the things that I've learned in Chinese medicine, because I feel like chemistry and our understanding of what our bodies are doing has taken a long time to learn and to understand. And in Chinese medicine, because everything's more global, some of the descriptions are now being understood scientifically. Does that make sense?
Interesting. Yeah.
So as we get older, the chemicals that our brain produces start to change, as do our hormones.
Okay. Yeah.
So
interesting. So yeah, what are the health concerns relating to brain aging then?
Well, there's so many.
I understand.
Yeah. One of my really big interests, and maybe I'll spend a little extra time on this because I've seen it a lot, is head injuries and falling. So as people get older, it's like today I saw a woman who is 72 and she has been falling a lot. And so the danger is that she will fall and hit her head. But our brains are literally, they're very, very, very soft. And they're inside of a bone cage, right? And there is just a little bit of fluid, about this much fluid, between our skull and our brain. So it floats in this fluid. And if you do anything, bang, you're bumping that very, very soft tissue up against something.
Okay.
So now, actually, there's a lot of research on head injury and what constitutes a head injury. I had a patient a few years ago. She was 60, and she fell, or no, she was in a car accident, and she actually just had a whiplash injury. She didn't even hit her head, but because she had no hormones, her ability to heal was lower, and the impact of the neck injury, when you have a big impact, what happens is your head goes back and forth. Your brains get squished up against the front, and then they get squished up against the back. It took her 2 years to recover, and she had acupuncture and she had hands-on treatment from that injury to her brain. And I mean, I knew that it was that problem, and so I was treating it, and many people don't know it and they don't get treated. So that's one. And then there's, of course, declining memory.
Sure, yes. And where is it? Where is the key to the car?
And memory, again, memory could be a whole show all by itself, and it's been, many TV shows, because we talk about dementia and Alzheimer's and all those different, but there's simply just not remembering where your keys are when you walk into a house, and people think, well, that's a precursor to Alzheimer's, and it isn't. There are different levels of memory problems, but medications because as people get older, they're often put on a lot of different medications, and they have other health issues, and medications affect how your brain works.
Sure.
In fact, another patient that I recently saw has been on antidepressants for 30 years, forever and ever and ever. And she's now feeling that those antidepressants have impacted her sense of movement and her ability to focus and think. Now, I don't know if that's true. I don't know if there's even literature on that. But we don't know the impact of our brain on some of the things that we do. Things that we take for granted should be okay, but we don't know what's happening to our brains. So there's Alzheimer's and head injuries and high blood pressure causing a risk for stroke. There's blood sugar problems, diabetes, and that can cause brain problems because the circulation in the brain can change. There's brain tumors. I mean, there are so many different health issues that we have to pay attention to. I think there's depression and mood disorders because I don't look at the brain as a thing all by itself. I look at it as a part of a triangle of 3 very important elements that support our whole body.
Okay.
So our hormones, our brain function, and our immune system are a triangle that need to be friends with each other, and they need to be in communication with each other in order for our system to work well.
Okay.
And as we get older, one of the main things that happens is that many of our hormones decline. And when our hormones decline, then the brain doesn't have the same amount of fuel that it had. And it causes the immune system and the brain to be less efficient, just as our hormones are less efficient.
Okay.
All of those things can be supported in different ways, but as all these things, as we age, there's a risk that these things begin to be more of a problem.
Interesting. Yeah, how about sleep problems or sleep disorders? That's also a sign of brain aging?
Well, sleep can be a sign of brain aging, but it can be many things. So sleep, again, is one of those things that it can have many problems. Like sleep apnea is not necessarily a brain problem. That can be a physical, where physically, when you're overweight, you can't breathe right. So people who get overweight, it's not necessarily a brain problem.
Okay.
It can be a brain problem.
Okay.
It can be an imbalance in melatonin.
Yes.
Because melatonin is produced in the brain, and so we can have problems with sleep because of that.
Yes.
We can have problems with sleep because our hormones aren't working. Because when progesterone levels go down, a lot of women start having trouble sleeping. In fact, some men start having trouble sleeping when their progesterone levels are low, even though they don't produce as much progesterone.
Okay.
So there's many, many, many levels of sleep imbalance, and brain is just one of them.
Okay. Sounds good. So how do we take good care of our brain to slow down that aging problem?
Well, it's always, everything's tied together as always. But first of all, of course, is healthy nutrition. I was just talking to a friend of mine the other night, and she's had financial problems, and she's 65. And because she's had financial problems, she decided for some reason that eating Jack in the Box and McDonald's was a good thing.
Right.
But it slows down your brain when you don't eat good food, when you don't nourish it well. And there's a book that was just published that I find really fascinating. I actually posted it on my Facebook page. It's a neurologist who wrote this book that, we've always thought that a healthy diet was good, high carbohydrate, low fat, minimal lean protein, and using whole grains. Well, his research seems to indicate that eating a lot of carbohydrates actually sets you up for more memory problems and more brain problems, because the brain likes fat. I used to say that we're fatheads, because all of the synapses and all the nerve cells, they're fueled by fat. They're fueled by these things called phospholipids. Lipids are fats.
Okay.
And so our brain works best when it gets a lot of good fat. And now research, for a long time they said that we shouldn't even eat saturated fat. You know, that coconut oil was bad and some of those hydrogenated fats were bad. Well, newer research now shows that maybe even those fats are essential for our brains to function well. And that the more carbohydrates you eat, the worse it is for your brain.
Wow. Yes.
And that's not just simple sugars.
Right. Yeah, I was going to ask simple versus
No, apparently,
complex
according
carbs.
to this guy's research, apparently even whole grains, because so simple sugars bring your blood sugar up and then they drop it down. Complex carbohydrates, which are supposed to be better, bring your blood sugar up and then it stabilizes. And apparently if it stays up, that's almost worse for the brain, according to what he wrote. So I think that's fascinating. I'm sure it's going to become more controversial, but one of the many things that I am always interested in is how many things we learn, and then we learn something different, and then we learn something different, you know, in science.
Right.
So this is why I always say listening to your body is better.
Yes.
I mean, science is important, and information and knowledge is really important, and I value it highly, and I use it to understand my own work. But your body is different than every other person's body. And what works for you may not work for somebody else. And so that is a really important component to being as healthy as you can anytime.
Okay.
So good nutrition, exercise, having a good attitude. You can change how you think. And that's the most important thing, is learning how to manage what your brain produces, because we can have control over our own thoughts and our own emotions. And that, you know, there's so much literature that shows positive thinking and having a good attitude help you be healthier overall.
Right.
And being a happy person helps you be healthier.
Yeah, just smiling actually makes a big difference.
Right.
Yeah. And then I know you mentioned a while ago about the antidepressants and you know, toxins affect the brain aging as well. So if we can limit that.
Well, it's hard to, with what's happening in our environment, it's hard to limit that, but you can. There are many things we can do to minimize the number of toxins that we get exposed to. Keeping our hormones balanced will keep our brain functioning better, and there are natural ways to keep your hormones balanced.
Okay.
So
yeah. And then, so let's talk about the dementia and Alzheimer's. Like, what's the difference between the two? And I know it's related to memory problems. What happens? How can we prevent it from happening? And if it does happen, like, how can we slow it down or cure it? Or what do you think?
Well, I mean, it's not completely understood what causes it. I mean, there are lots of theories. There's one that there's aluminum toxicity. There's some genetic issues that seem to be connected. I had a friend whose father had Alzheimer's at a fairly young age, and he was in the 90s. He was really active in taking, there was a drug called MDMA or ecstasy, and people who take ecstasy, what's happening is when you take it, it squeezes all the serotonin out into your tissues, and so it depletes the serotonin in your brain. And he got Alzheimer's at a very young age. He was only 60, and or actually it started even in his late 50s, and that's fairly young for Alzheimer's. So it seems that what happens is that the brain shrinks. And then your ability to recognize things and recognize people and where you are and becomes less and less and less, and your ability to process certain thoughts becomes less and less. So it's a very sad disease. And the difference between dementia and Alzheimer's is hard to distinguish. You know, both of them have the same kind of symptoms where you become less and less able to think.
Okay.
Yeah. So sometimes they're interchangeable in the definition, unless somebody has a family history of Alzheimer's.
Okay.
what you can do to prevent it, of course, is to take care of your nutrition and to exercise regularly and to, as much as possible, take care of your life.
Okay.
And from a young age, and not to take drugs, and not to take mind-altering drugs, you know, and not to do too much alcohol, because all those things deplete your brain's ability to function.
Okay.
But even that now is up for conversation, and I'll give you some information in just a minute after I finish answering your question about that. But other things, again, as hormones decline, our brain's ability to function declines, because hormones support our brain, and our brain supports our hormones. So it's a feedback. And there are certain nutrients that help support the brain, like eating a high-fat diet and eating a low-carb diet and sustaining your blood sugar. All those kinds of things will support your brain. So the better you eat, the more your brain will work better for you. The more you exercise it. So things like Sudoku and word puzzles, all of these things have been shown to actually improve brain function. And for Alzheimer's too, you can slow decline by actually exercising the brain.
Okay.
This person that I know who has Alzheimer's, I know him pretty well. One of the things that improves him is when he travels, because he has a new environment, it stimulates his brain, and so then he's a little bit more functional for a while. That's not always the case, you know, because as people decline, they can't really travel too much anymore. But supporting their hormones, you know, DHEA is a hormone that's made by the adrenal glands, and it's actually been shown to help decrease decline in Alzheimer's in some studies. B vitamins, brain chemistry support, like amino acids, will help make serotonin and GABA and all of those things. So there's a lot to do that might slow it down a little, besides the medications that people are given, which are also pretty effective.
Okay. So yeah, so good nutrition and then supplementation if necessary with all that, vitamins, etc.
Yeah.
And then so as far as if you had it, can you slow it?
That's how you would slow it down.
Okay. So it's just some medications as well as supplementation.
Right.
Okay. How about Parkinson's?
I want to go.
Before that.
I don't know how much time I have left.
I think we have 5 minutes.
Okay. So I'm just reading this book called Super Brain, and it's by Deepak Chopra. And he talks about how plastic our brains are. And you know, when I was in medical school, which is a very long time ago, almost 30 years ago, we learned that once you kill a brain cell, you will never get another. And that is fairly common knowledge, or fairly common thinking, is when you kill a brain cell, you will never get another. And it's one of the theories about Alzheimer's is as your brain declines, you can't rebuild it. Well, that's not actually true. You can rebuild it, and your brain cells do regenerate, or you can get new ones. So when you lose certain parts of your brain, you can actually heal it and heal your brain. And that wasn't common knowledge not that long ago. So there's this, I remember so many things in med school that we learned, you know, this can't heal, and what we're learning is everything can heal.
Interesting.
Including our brain and our nervous system. Or like if you have an injury to a nerve, you know, let's say you get cut here and you get numbness from here on down, that it can't regenerate. And it takes a very long time because the nerve cells grow slowly, but they can.
Okay.
So some of what happens in our bodies is just how we think.
Okay.
So
the power of
the power of thought, yes. And so one of the things, you know, maybe I don't know, I don't want to say I'm unrealistic, but I believe in healing. And I believe in the possibility of anything being able to be healed. I have a friend who was also my patient. She actually became my patient before she was my friend, who had a serious head injury a number of years ago, a very serious head injury. But she did everything in her power to heal that. She was in a car accident and hit at a very high speed. And at first her MRI was normal. So first of all, it's hard to diagnose head injuries. And then second of all, healing them, because nobody really acknowledged them for so many years, it was hard to actually figure out that you could heal them. But she went to various people for various kinds of treatment, and full function of her brain is back. So you can heal.
Yeah. That's all.
Or the other woman that I told you about who had the bad whiplash. It took 2 years, but she healed, and her brain is working now, you know. So you can heal. And it's the idea that, you know, that cells can be born new and you can regenerate nerve tissue and things like that. I think that's a very important thing to hold on to.
Right, right. And it's good information, because I know that, you know, like you're kind of a new person, because the cells regenerate within 7 years, I heard,
Right.
except for the brain and the nervous system. But now you're saying that everything. So you become a new person.
Yeah.
Yeah. So how about the Parkinson's? Can you describe what that is?
Well, what we know about it,
Okay.
and again, I'm not a world expert on Parkinson's, so
Sure.
but basically the idea is that there's not enough dopamine, and
Okay.
dopamine regulates a certain part of our movement. So as Parkinson's progresses, less and less dopamine, you get this tremor, and the tremor is called an intention tremor. So any intention of movement, and you start to shake more. And then you also have this, they call it mask. So you become really stiff. You become progressively more stiff, and movement becomes more and more difficult. And so the medication that's given is called L-Dopa, and it is for replacing the dopamine, and it seems to be fairly effective. And again, there's treatment of a disease. So Parkinson's and Alzheimer's, they're a disease, and there are medications, and some of them work pretty well. But there's also taking care of the whole body, because the better the body is functioning, the better everything else functions.
Sure.
So again, with Parkinson's, hormones are usually low. Testosterone is a hormone that helps with energy and helps muscle strength and helps movement. And so you can measure all these different hormones, and you can see what is happening with them. And if you don't necessarily have to give a person hormones, but there are herbs that will do similar things to support the whole body's energy that will make the Parkinson's progress more slowly. It may not necessarily cure it, but make it go more slowly. And again, good nutrition, exercising, positive attitude, all those things help. Does that make sense?
Yes, yes. Okay. Well, you know, before we wrap up this program, any other last minute thoughts?
Oh, I have so many thoughts.
Yeah, I know.
I think the most important is that whatever we're presented with by life, we don't always have control over what comes to us in terms of diseases or illnesses, but that there's always hope. And that there are so many possibilities, especially as we learn more and more. There are so many ways of treating things and so many ways to approach it that not to give up.
Okay. That's a good point.
And
It's really to stay positive, that there
and to
is
believe
hope.
in healing, because if you believe in healing, then you'll never stop looking.
Right, right.
For whatever answer works for you, you know.
And the body can be a miracle. It can heal itself. Yes. So how, if people wanted to find you, how are they going to find you?
I have a web page. I own Heart to Heart Medical Center, so it's easy to find me by looking up Heart to Heart Medical Center on the internet.
Okay.
And my web page address is www.hthmc.com.
Okay, great, great. Thank you. Thank you, Dr. Shiroko, for another stimulating discussion or conversation.
Thank you.
And thank you to our dearest viewers for watching this program. Thank you also to our Seroptimist volunteers who make this program possible. And last but not least, thank you so much to Rick and Leon of the Novato Public Access Television for their assistance and support throughout the year. So take care, and again, stay healthy, and we'll look forward to giving you better advice also on to how to live a vibrant life. Thank you. you.